Welcome to another deep dive. Today we're going to be unpacking some pretty cool research on epilepsy in dogs.
Cool stuff.
Yeah, and specifically we're going to be looking at a protein called C-reactive protein, or CRP,
Okay.
and its role in these patients.
Yeah, this is a really an area that I think is fascinating,
Yeah.
especially because it has potential for diagnostics
Absolutely.
in vet neurology.
Yeah, because, as we both know, differentiating between idiopathic epilepsy, where we don't know the cause, and structural epilepsy, where there's like a brain tumor or something like that, can be really tricky,
Yeah,
especially without advanced imaging.
absolutely. And this is what this study from 2023 in Veterinary Record was looking at.
Okay, cool.
Was can CRP levels help us distinguish
Okay.
between those two types of epilepsies?
Okay, great. So give me the headline. What do they find?
So they found that dogs with structural epilepsy had significantly higher serum CRP concentrations compared to dogs with idiopathic epilepsy.
Interesting. Okay. So tell me about the study. How many dogs were in the study? What were their diagnoses?
Sure. So there were 20 dogs in the study. 12 had idiopathic epilepsy and 8 had structural epilepsy.
Okay.
And of the dogs with structural epilepsy, 3 had confirmed brain tumors neoplasia.
Okay.
3 had meningoencephalitis of unknown origin.
Well,
And 2 had structural abnormalities, but the specific cause was unclear.
okay. So pretty good mix
Yeah.
of cases within that structural epilepsy group.
Yeah.
Did they talk about anything in the dogs with structural epilepsy that wasn't obvious?
Yes, and this is one of the things that makes this research so interesting, is that several of the dogs with structural epilepsy actually presented with normal neurological exams initially,
Wow.
even though they had identifiable brain abnormalities.
Wow.
Yeah.
That's a real challenge, right?
Yeah, absolutely.
Like if they have normal neuro exams, but they have structural epilepsy, that's tricky.
It is.
Okay. So let's talk about CRP. So what is it and why would it be relevant to epilepsy?
So CRP is what's called an acute-phase protein. It's produced by the liver.
Okay.
And it's a marker of inflammation. So whenever there's inflammation happening somewhere in the body, CRP levels tend to go up.
Okay. So the thinking here is that if you have a brain tumor,
Yeah.
you have damage to the brain, it causes inflammation, and that inflammation causes elevated CRP.
Exactly.
Great.
And that's exactly what the study found.
Okay.
So they found that over 60% of the dogs with structural epilepsy had CRP levels above the normal range, whereas none of the dogs with idiopathic epilepsy did.
Oh, wow. Okay, so that's a pretty stark difference.
Yeah.
But why would structural damage cause more of an inflammatory response than idiopathic, where we don't know the cause?
Yeah, that's the burning question.
Yeah.
And it likely has something to do with just the nature of the damage. So a tumor, for instance, is a growing mass of abnormal cells, and it disrupts the normal brain environment. And so that triggers an inflammatory response.
Okay, that makes sense. Did they look at any other inflammatory markers besides CRP?
Yes, they did. So they looked at things like white blood cell count, neutrophil count,
Yeah.
albumin and globulin levels.
Okay, and so did those show similar patterns?
So this is where it gets interesting.
Okay.
What they found is that CRP was more sensitive
Oh,
at differentiating between idiopathic and structural epilepsy compared to the other inflammatory markers.
okay.
And in fact, only a few of the dogs in the structural epilepsy group even had abnormalities in those other markers.
Interesting. So CRP is like the standout, at least in this study.
Yeah,
Why do you think it would be more sensitive?
that's a good question. I think we need more research to understand exactly why. But it could be that CRP reflects a more specific or more pronounced inflammatory response that's related to structural brain abnormalities.
Okay, so this is all fascinating stuff.
Yeah.
But for the dog owner out there, or even the vet, in their practice, what does this mean for them? How can they use this knowledge about CRP?
Yeah, that's the crux of the matter, right?
Yeah.
So while this was a small study, and we definitely need more research
Yeah.
to confirm these findings,
Sure.
it does suggest that CRP could be a really valuable tool for vets who are trying to determine if a dog's epilepsy is due to an underlying structural problem.
Especially in situations where they can't get advanced imaging right away,
Exactly.
because CRP is a relatively cheap test,
Yeah, it is.
and it's pretty accessible. So it could be a really helpful first step.
Yeah.
Okay, so we've kind of set the stage here.
Yeah.
CRP seems to be higher in dogs with structural epilepsy
Right.
than those with idiopathic epilepsy.
Yeah.
And it might give us a clue
Yeah.
as to which type they have.
Yeah.
So let's get into some of the nitty-gritty of this study.
Okay.
How did they measure CRP, and what other information did they get from these dogs?
So they measured serum CRP concentrations
Okay.
within 24 hours of the dog's last seizure.
Okay.
And they used a validated high-sensitivity assay. They also collected data on other inflammatory markers, like we talked about.
Okay.
White blood cell count, neutrophil count, albumin, and globulin levels.
Yep.
They also recorded each dog's breed, age, sex,
Okay.
details of their seizure activity,
Okay.
and any anti-seizure medications they were taking.
Okay, that makes sense. Get like a whole picture of the dog. And,
Yeah, a full workup, yeah.
Yeah. Anything interesting about the medications they were on?
Yes. Actually, this is really interesting. It turns out that most of the dogs with idiopathic epilepsy were on some form of anti-seizure medication,
Okay.
whereas only one dog in the structural epilepsy group had received medication within 24 hours of the CRP measurement.
Oh, that's interesting. Okay. So could that have skewed the results at all, do you think?
It's a good question.
Like, could the medications be suppressing CRP?
It's possible, and the authors did acknowledge that as a potential limitation,
Okay.
but they said that more research is needed to really tease out those effects.
Okay, fair enough.
Yeah.
So they got all this data. How did they analyze it? How did they figure out if there was a real difference in those CRP levels between the two groups?
So because the CRP data wasn't normally distributed, they used a non-parametric test called the Mann-Whitney U test
Okay.
to compare the median CRP levels
Okay.
between the two groups.
Okay.
And that showed a statistically significant difference,
Okay.
with the structural epilepsy group having higher CRP levels overall.
Okay, so it wasn't just random chance.
Right.
There was a real pattern there.
Yeah.
Okay, and you mentioned that they looked at other inflammatory markers. What did they find there?
So, again, this is where it gets interesting. What they found is that CRP was more sensitive at differentiating between the two types of epilepsy compared to the other markers. And in fact, only a few dogs with structural epilepsy even showed abnormalities in those other markers.
So CRP really is a standout.
It is.
Okay, so it seems like it could be a valuable tool,
Yeah.
but no study is perfect. What were some of the limitations?
You're absolutely right. So the authors were upfront about the limitations. The biggest one is sample size.
Of course, yeah.
Only 20 dogs.
Yeah.
It's hard to draw firm conclusions.
Yeah.
And then even within the structural epilepsy group, there was a mix of causes, as we talked about.
Tumors, meningoencephalitis.
Exactly.
Okay.
And that could have added some complexity to the finding.
So small sample size and then the mix of causes.
Yeah.
Any other limitations?
Yeah. They also pointed out that they couldn't completely rule out the possibility of other underlying conditions contributing to those CRP levels.
Sure.
So while they did exclude dogs with obvious signs of other illnesses,
Right.
there's always a chance that there could have been something else going on.
Right, always those confounding factors.
Exactly. And then there's also the issue of timing.
Okay.
So they measured CRP within 24 hours of a seizure.
Right.
It's possible that CRP levels fluctuate over time.
Yeah.
So we don't know what those levels would look like if they were measured, say, a week after a seizure.
So we need to be cautious about drawing conclusions about dogs that haven't had a recent seizure.
Exactly.
Okay. So despite these limitations, this study does provide some pretty compelling evidence
Yeah, I think so.
that CRP could be a useful tool.
Yeah,
But like we've said, there's a lot more research that needs to be done.
definitely.
What kind of studies would you like to see done in the future?
Well, first and foremost, like we've talked about bigger studies
Yeah, bigger studies for sure.
with more dogs
Yeah,
would be
yeah.
really helpful. And I think these studies could also focus on specific subtypes of structural epilepsy.
Okay, so like dogs with brain tumors versus dogs with meningoencephalitis.
Exactly.
That'd be really interesting. See if there's different patterns
Yeah.
with the different types. What about those confounding factors? Any way to kind of get around those in future research?
I think one approach would be to include a control group of healthy dogs
Okay.
that don't have epilepsy.
So that could help us establish a baseline for CRP levels in the general population.
Okay.
Researchers could also use more advanced statistical techniques to
Okay.
control for potential confounding variables.
Okay, cool. So bigger studies, more specific subtypes,
Yeah.
tighter controls. Any other directions you'd like to see future research go?
I think it would be really interesting and valuable to explore how CRP levels change over time
Okay.
in dogs with epilepsy.
Okay.
So we really need to understand how those CRP levels relate to things like seizure frequency,
Okay.
seizure severity,
Okay.
and even treatment response.
Okay. So that gets back to that question of, can we use CRP to monitor how well treatment's working or even predict if a seizure is going to happen?
Exactly. That's really the game changer,
Yeah.
isn't it?
Yeah.
If we could identify patterns in CRP fluctuations that correlate with seizure activity or treatment response,
Right.
that would be huge
Yeah.
for how we manage epilepsy. Like, imagine being able to change a dog's treatment plan based on their CRP levels.
Yeah. And potentially even prevent seizures
Yeah.
before they happen.
That's amazing.
It's a very exciting prospect. I think
Yeah.
there's a lot of potential for CRP to really impact how we diagnose, manage, and even prevent seizures in dogs with epilepsy.
So we've kind of unpacked the details of the study, explored its limitations, and even looked ahead at some exciting avenues for future research. So what are your overall thoughts? What are some key takeaways?
I think this study, though, small and preliminary, provides some pretty intriguing evidence that CRP could be a valuable addition to our diagnostic toolbox for canine epilepsy. However, like we've discussed extensively, we need more research to fully understand its role.
Okay, well, that's a great summary. I'm really excited about the possibilities here. So in the next part of our deep dive, let's zoom out a little bit and talk about the bigger picture of this research.
Okay.
Where do we go from here? Where do you see all of this heading?
I'd love to talk about that. We can talk about what this means for the future of epilepsy diagnosis and management in dogs and how it might impact veterinary practice as a whole.
Awesome. Well, let's pick up that conversation in part 2.
Sounds good. Welcome back to our deep dive on CRP and epilepsy.
All right, so let's talk big picture. If these findings hold true in larger studies, what could this mean for the future of vet neurology?
Well, one thing that really excites me is the potential to make really crucial information more accessible.
I like that, making it more accessible. Can you expand on that a little?
Yeah, sure. So, for a long time, we've relied heavily on things like advanced imaging and other really fancy tests to diagnose structural epilepsy in dogs.
Yeah, and like we talked about before, that can be super expensive and just not available in every practice setting.
Exactly, but a CRP test is pretty cheap, and it's available pretty much everywhere. So it could help level the playing field a bit, give more vets the power to make good decisions about a dog's care, even if they can't refer right away to a specialist or get advanced imaging.
Absolutely, and that could lead to, faster diagnosis, earlier intervention, and hopefully a better outcomes for the dogs.
Definitely, and I think it would mean less stress for the owners, too, knowing that their vet has the information they need to help their dog.
For sure. And this research really emphasizes how important it is to just keep looking for new tools and new biomarkers for vet neurology.
Absolutely. We're always learning new things and discovering new ways to improve the care we provide.
So let's get back to that big question we've been dancing around.
Okay.
Can CRP levels be used to track how well treatment is working or even predict when a seizure might happen?
Well, that's really what we'd like to know, and unfortunately, this study can't answer that for us definitively.
But it definitely opens the door to some interesting possibilities.
It definitely does. Imagine if we could watch CRP levels over time and see how they change in response to a dog's meds.
Or if we could pinpoint, a certain pattern in CRP that meant a seizure was more likely.
And exactly. That would completely change how we manage epilepsy.
Right.
And it would let us tailor treatment plans and even step in before a seizure happens.
It would be a whole new level of personalized care for these dogs.
Exactly. And even if CRP doesn't end up being the perfect answer, I think this research is still pushing us to think differently about how we diagnose epilepsy.
It's like looking beyond the usual tests
Yeah.
and thinking about how things like inflammation could be playing a role
Right.
in this complicated condition.
It's a good reminder that the brain doesn't just exist on its own.
Right.
It's connected to the whole body.
Right.
And we need to look at the big picture to really understand and treat these neurological problems.
I think that's a really important point. I think we've done a good job breaking down this study,
Yeah.
talking about what it means and where we go from here. So what are your final thoughts?
I think this study, even though it was small and we need more research,
Of course. Yeah.
gives us some really exciting hints
Okay.
that CRP could be a really useful tool for diagnosing canine epilepsy.
Yeah.
But as we've said many times, we need more research to know for sure.
Well, I think that's a great summary. So in the last part of our deep dive,
Okay.
let's shift gears a bit and
Yeah.
talk about some of the bigger implications of this research.
Okay.
Where do you see this research leading in the future of vet neuro?
I think that's a great topic to discuss. We can talk about what this research means for diagnosing and managing epilepsy in dogs moving forward and how it could change veterinary medicine as a whole.
Awesome. Well, let's continue this conversation in part 3.
Sounds good.
Welcome back to our final segment on CRP and epilepsy in dogs.
It's been a great deep dive.
It really has.
Yeah.
So we've talked about the study itself, the limitations and some potential directions for research.
Right.
Now let's zoom out a little and think about the bigger picture here. If these findings are confirmed in larger studies, what could this mean for the future of veterinary neurology?
One of the most exciting aspects, I think, is the potential to really democratize access to this important diagnostic information.
I love that phrase, democratizing access. What do you mean by that?
So for a long time, we've relied so heavily on advanced imaging like MRI or CT to diagnose structural epilepsy in dogs.
Right. And as we said, those tests can be really expensive and they're not available everywhere.
Exactly. But CRP is a relatively inexpensive blood test, and it's widely available.
Yeah.
So it could really help level the playing field, give more vets the tools to make informed decisions about a dog's care, even if they don't have access to a specialist right away or they can't get advanced imaging.
Absolutely. And that could lead to faster diagnosis, earlier intervention, and hopefully better outcomes for the dogs.
Exactly. And I think less stress and anxiety for the owners, too.
Yeah, for sure.
Knowing that their vet has more information to work with.
Absolutely. And this research really highlights the importance of constantly, searching for new tools and biomarkers in veterinary neurology.
Yeah, absolutely. We don't have all the answers, and we're constantly learning new things.
Right.
Discovering new ways to improve the care we provide.
Yeah. Okay, so let's revisit that big question that we've been coming back to again and again. Could CRP levels be used to monitor treatment effectiveness or even predict when a seizure might happen?
That's the big question, isn't it? And unfortunately, this particular study doesn't give us a definitive answer on that.
Right.
But it does raise some really intriguing possibilities. Imagine if we could track those CRP levels over time and see how they correlate with the dog's response to medication.
Right. Or if we could identify certain patterns in CRP that meant a seizure was more likely to happen.
Right. That would be a huge advancement in how we manage epilepsy. We could tailor treatment plans and intervene proactively.
It would be amazing. A whole new level of personalized medicine for these patients.
Exactly. And even if CRP doesn't end up being, the perfect answer, I think this research encourages us to think differently about epilepsy diagnostics.
Right.
To look beyond the traditional tests.
Right.
And consider things like the role of inflammation in this really complex condition.
And it reminds us that the brain doesn't exist in isolation. It's connected to the whole body.
Absolutely.
We need to consider that to really understand and treat these neurologic problems.
I think that's a key takeaway from our discussion.
I agree. I think this deep dive has been really fascinating. We've learned a lot about CRP and its potential role in diagnosing epilepsy in dogs.
It has been.
Unpack the study, its limitations, and even envision some really exciting possibilities for the future.
Yeah.
And while there's still a lot more to learn, this research definitely offers a glimmer of hope for a future where we can diagnose and manage epilepsy more effectively and really improve the lives of so many dogs and their families.
Absolutely a vision worth striving for.
For sure. From Vet NeuroJar, keep those minds inspired, hearts light and tails wagging.